My specific focus is on family planning, and what does that mean, especially within this era. Now we know that the aim of national family planning is to enable access to contraceptives for all women within the reproductive age 15 to 49. And we know that there are some important considerations. The young people in particular need to delay pregnancy, they need contraceptives, and we know that you should wait at least 2 years in between having children. And most importantly, having more than 4 children makes childbirth riskier. And so if we were to look at what our main challenges, it's in relation to young people or teenage pregnancy and the issue of multiparity for some of our population. So we have as our thrust the need for a comprehensive package of family planning services to reduce unplanned pregnancies and address unmet family planning needs. We also have as our responsibility the creation of an enabling environment for the delivery of family planning services. We have to look at issues of gender-based violence and look at the capacity of our other partners or civil society partners to integrate family planning and SRH and HIV prevention, care and support services. Now, when we look at this mandate, we recognize that there are certain barriers that we have to address in order for us to look fulsomely at the issue of choice. And one of the main barriers is it's recognized as a structural barrier. Within our environment, we recognize that there are some political and legislative issues which have to be addressed in order for us to increase access of our youth to contraceptive methods. The local legislative environment, example, the Child Care and Protection Act, and everyone here is aware of this particular issue, is a barrier to sexual and reproductive health of adolescents who want to prevent pregnancy and the contraction of HIV/STI. It does not make provision or any accommodation for the adolescent below 16 years, and it treats any form of enabling of access to contraceptive methods as aiding and abetting under the law and thus attract the position of a misdemeanor. So we're speaking about choice for our adolescent or youth population. And we recognize that we had the age-specific fertility rate for adolescents between 15 to 19. Well, our old data was 60 to 72. We just learned this morning that it's way down at 46%. But we recognize also it has moved from being the 4th highest to the 3rd highest within the Caribbean. So we still have our challenges. Now there are some systemic barriers. We have recognized that while there have been major efforts to increase the availability of contraceptives, we recognize that stockouts occur. And we have done extensive training as it relates to contraceptive logistic management system within the public health. But we recognize that as we have done our survey, that there are issues relating to contraceptive management, such as storage and ordering patterns. So while we recognize that we have been procuring the commodities, the ability to order on time and to maintain a management of the system presents a challenge, and so we have stockouts occasionally. But let's get to the other very personal level of the client level barriers. Now we recognize that for individuals to really accept family planning methods, they have to be able to be aware of the information. Right now in Jamaica, the most common contraceptives are the Depo-Provera and the pill. The Depo-Provera, the male condom, and the pill. But the selection of these contraceptive methods is influenced by the availability of information by the healthcare provider and the media, information from friends and family, partner preference, the availability and the desire to delay the pregnancy. So if these are the enabling factors, what are the challenges as it relates to client level barriers? Where we have issues around the lack of knowledge about the services, and we have misconceptions or exaggerated concerns about the services. There's mistrust of the family planning system and mistrust of the family planning methods. And of course, the issues around gender. So we have a lack of partner support and an overemphasis sometimes on the female and not sufficient involvement of the male in the reproductive health education.